Okay, good afternoon, everybody. We're going to begin our joint COVID-19 weekly press briefing. And this is a briefing that's put on behalf or through, I guess, or with the persons from Nueces County and the city of Corpus Christi. And today I'll be speaking initially. My name is Peter Zanoni. I'm Corpus Christi City Manager. And what I will be doing is updating the community on our caseload and recovery rates for individuals that have had COVID. The last time we were here presenting was a week ago today, and except for the Friday presentation where we had Dr. Bird and Dr. Tussaud from Texas A&M Corpus Christi providing their trending analysis and other scientific and other observations that they've been providing for a couple of months now, and they'll continue to do that on Friday at 3 o'clock. And our format, what we're using now, is every Wednesday at 5 o'clock, the city and the county come before you to present information on COVID-19 and updates on it, as well as updates on any orders or recommendations on how to stay healthy. And so what I'll do is go over the statistics, as I mentioned, and then Annette Rodriguez, our public health director, will speak for a little bit. We have Mayor McComb is here today, as is Judge Canales. Between the two of them, they will be informing us of just recently received information from the governor, where he continues to open up the state of Texas. And so we're going to see if we can decipher it as best we can. We just now, like a minute ago or so, got it. But we'll be able to communicate to the community through this forum our initial analysis on what the governor is allowing to happen in Texas in terms of more things opening in our communities. And okay, so before we get into the numbers, we do want to thank our networks that are here. We have Chris 6 and KIII. We appreciate their continual coverage to help the community stay informed. We also have our local newspaper, the Caller Times. We want to thank them for being here and sharing this information with the community. We want to thank those that are watching on Facebook and YouTube, the city's channel, and through the network channels as well. The important thing is you getting good information and then sharing that with your family, friends, relatives, neighbors, church-going folks, and others. So we appreciate you tuning in. We'll be watching Facebook through the briefing this afternoon, try to comment on some of your questions and comments as well. That's a big part and kind of a fun part as well of our briefings each Wednesday. Okay, so what I want to do is go over the cases. I'm not going to do what I had done on a daily basis. Instead, we're going to look at this at a weekly basis, kind of our new format. So what you have is our 7-day chart here. You can see today is Wednesday. That's the furthest blue bar on the chart. That's 5 new cases today. Yesterday we had 5 new cases. The zeros is Monday, 0 Monday. Sunday would be 1 case. We did have 6 cases on Saturday, but then Friday and Thursday were zeros and zeros. And so for this week, if we look at a week back in time, a total of 17 cases for the past 7 days. What I want to show you is last week's 7-day chart. And a quick count on last week will show there were 12 cases over that same 7-day time period last Wednesday when we were showing the community the same information. And so we have 5 more new cases this last 7-day period than the last 7-day period, which is not a good thing. 7 new cases. You can see the trend of a week ago was 4, 0, 2, some lower numbers. So this week's 5, 5, and 6. If we go back to that first chart maybe real quick, you can see some of these big numbers are causing us to have that bigger cumulative caseload for the past 7 days, even though we had some zeros. But the 5 today, the 5 yesterday, and the 6 on Saturday is different compared to let's look at last week's 7-day one more time. Yeah, there we go. So you can see we had some 2s, 1s, and zeros, a high 4. So we hope this doesn't continue because it's not what we want. We want less cases each week and over time. Okay, what we're going to show you next is our donut chart, we call it, but this shows recovery rate. So while we do have new cases, and that's expected, and we want them to stay low, though, key thing to focus on is this bigger slice here. So of all the cases that we've had in our community, 172, or 64%, more than 50%, so 64% of the persons have recovered to date. And that leaves us 110 active cases that are out there still today. And those folks are in quarantine or in the hospital. And we know that we have had 3 deaths because of COVID-19, and that number hasn't changed in many, many weeks, which is a good thing. Of the 110 active cases, 7 of those persons are in the hospital recovering, and of the 7 that are in the hospital, 4 are in intensive care, so they're recovering in the intensive care unit of the hospital. Okay, so that number is a little bit high. Last week, it was in the 4, 5s, and 6s or so. But this week, as of today, 7 are in the hospital and 4 are recovering. Okay, and then we want to look at a bigger than a 7-day trend, because that really helps us analyze how things are going overall in terms of implementation of policies and how folks are doing with social distancing and following some of the health practices that we've been saying for many months now, to include washing your hands frequently, keeping dirty hands off your face, staying 6 feet away from somebody that's next to you, wearing a face mask if you're in public, with a big crowd especially. So on our longer-term analysis, you can see over time this shows testing, and the blue bars going up and down are the average, not the average, but the daily test numbers. You can see on this side over here. And then we did draw that orange line, though, that shows a 7-day trending average. So the 7-day average, you can see on testing, we had a high peak, and then we moved out in another little bit of a high peak, but there's been a little bit of a drop in the last couple of days. Those peaks were caused from extensive testing that were taken at a meat processing plant, as well as at 2 transitional house facilities, and then also senior facilities, nursing homes and others. There was a lot of testing done there that caused the peak. You can see even with the dip, though, from today at 6/3, we're still doing more tests than we had back here when we were initially in the beginning stages of testing and setting up our testing procedures. Through this week, let me see, the average test, the 7-day average, if you take a 7-day average, last week we were doing 185 tests. I'm sorry, this week, our 7-day average is 185 tests. When you take that 7-day outlook, we're doing 185 per day. Last week, we were doing a little bit more, 302 on a 7-day daily average, right? And that was because of those big testing initiatives in our senior facilities, as well as some of the transitional homes and the meat processing plant. So on average, we're doing 185 tests per day is a summary on that. A key number that we are tracking, and we still are, is the total number of tests taken. And as of today, through all means, whether it's the city-county testing drive-through site, the National Guard testing at particular locations, or hospitals and private physicians testing through some of the commercial labs, we have tested over 11,000 persons, so 11,246. I remember when that number was not even quite 3,000, right? So we're way up there in the tests performed to date, and the mayor likes to track this statistics, but the percentage testing positive continues to drop. So we're testing more, even though there's still a few more cases this week, say, than last. The number of persons that are testing positive, that average is dropping. It's down to 2.5%. Last week it just dipped below the 3%, so it's continually and steadily dropping, which is a good thing. We're testing more people, but what we're finding, a few of them are positive. So that's one good statistic to report out today. So that 11,000, it's 11,246 of all the tests we've performed. When you think of our population of about 360,000 in the city and the county, that's 3%. And those watching that have always watched, we're recalling back to the days when we weren't even at 1% of our population. So we've tested 3% of our population, which is a decent statistic. Okay, and then let's look at the number of cases. This next graph here shows us that trend line as well. And you can see that we had the big spike. This is the number of positive cases, and that was from our outbreak scenario areas, the meat processing plant and the transitional houses. You can see it dropped pretty significantly. It's gone back up a little bit at that tail end down there. from this last week in particular, where we've had some 5s back to back. This week, our average cases per day, when you look at that 7-day trend, is 2.4. And consistent with what I've been saying in terms of more cases, the 7-day average from a week ago, when we look at the last 7 days, was 1.7. So last Wednesday, we were talking about 1.7 on average. Today, for this past week, it's 2.4 cases per day. That's the average caseload. Okay, so we want to try to bring that number down. And people like Annette are going to remind us about what we can do. Annette Rodriguez, our health director. We're not out of the woods by any extent of the imagination. I know we have a lot going on in our country and locally, but we have to remember the things that made COVID-19 a problem are still the reality, which is there's no vaccine, there's no cure. Our bodies have no immunity unless you've had the virus. It's highly contagious, and its transmission rate is much more than any other virus we've ever seen. So not only is it contagious or easy to catch, but when you do catch it, it's easier to spread, right? So the recommendations or the solutions to all those negativities is the following, which is protect yourself, protect your family, wear a face mask if you're in groups of persons, especially if you can't social distance. If you're in the grocery store and malls and even maybe outdoor settings where there's big groups of people, wear a face mask. The other one is keep your hands clean. Don't forget to continually wash your hands. If your hands are dirty, keep them off your face. That virus can get on your hands. If you touch your face, your eyes, your ears, it can get into your body, and that's it. So keep your hands clean, keep your hands off your face. Wear that face mask. Social distance. There's still nothing wrong with staying home. Even though a lot of things are open, it doesn't mean we have to rush out and go out. Keep your family at home if you feel unsafe. The virus still continues to spread, as evidenced by our caseload is still increasing, and this week it's more than last week. So those are some advice points. We're going to translate the statistics and some of what I said into Spanish, and then we're going to have Annette Rodriguez come on up and give us some more health tips, and then we'll have Judge Canales come up from Nueces County, Judge Barbara Canales, and then Mayor McComb is here as well, and they'll share some information on the governor's orders and then some other city-county business for the city residents watching to consider.
Las cifras más recientes indican que en las últimas 24 horas se han reportado 5 casos confirmados por el coronavirus, haciendo un total de 285 casos. En los últimos 7 días se han reportado 17 casos. A la fecha se han llevado a cabo 11.246 pruebas por el virus entre el Distrito de Salud Pública, laboratorios privados y la Guardia Nacional. 172 de los 285 casos se han recuperado por completo. 7 personas continúan en el hospital. 4 de esas 7 personas están en la unidad de cuidados intensivos. 110 personas son casos aún activos. A la fecha se reportan 3 fallecimientos. 185 pruebas se han llevado a cabo en promedio diariamente. En total se han llevado a cabo más de 11,000 pruebas entre el Departamento de Salud, laboratorios privados y la Guardia Nacional. El promedio de las personas que resultan positivas continúa disminuyendo. Se estima que alrededor del 3% de la población ha sido examinada por el virus en nuestra comunidad. Se continúa recomendando que tome todas las precauciones para prevenir los contagios. Use cubrebocas y lave sus manos lo más frecuente posible.
Thank you. Annette Rodriguez, Health Department Director. The Health District, in collaboration with the Fire Department and Crisis Bond, have completed the testing of the local nursing homes as per Governor Abbott's directive. Over 2,300 residents and employees were all tested, and a total of 11 came back positive, but all of these were asymptomatic individuals. 1 nursing home is testing independently, and their test should be completed shortly. The Health District resumed our weekly drive-thrus today. The drive-thru went very well, and we had 32 samples that were collected this morning. The next drive-thru will be next week, next Tuesday, at the Hilltop Community Center in Calallen. If you have symptoms of COVID-19, call our hotline at 361-826-7200 for an appointment to go through the next drive-thru. Other testing options are available in our community. There is CVS Pharmacy that recently came online. Their number is 361-814-8305, and we're being told they have a 3-day turnaround time for results. There's also Amistad Clinic, and their number is 361-884-2242, extension 107 or 207 or extension 135. There's also the MTTs, the military testing teams, at the 512-883-2400, or the website is the texascovidtest.org. So I have some very exciting news to tell you about. So the long-awaited Health District Panther testing system has now been validated as of today in our laboratory. This system increases our lab capacity by at least 500 tests per day, so probably closer to 750 tests. 250 tests can be resulted in about a 4-hour time period. I want to say thank you, a big thank you to my lab staff who have worked really hard. They're also the first laboratory response network to go live with the Panther here in the state of Texas. They've worked diligently to validate the system and conduct proficiency testing to have this increased capacity for our community. So thank you to our lab staff. The economy. As the economy continues to reopen, we ask, as City Manager mentioned, that you continue practicing the NPIs, the non-pharmaceutical interventions, washing your hands, social distancing, disinfecting commonly touched areas, and not infecting yourself by not touching your eyes, nose, or mouth with dirty hands. So I do want to take a minute to recognize that many of you have been very good at following these practices, because we have not seen a big upswing in COVID-19 cases in Nueces County. While the impact here in Nueces County has not been as severe as in many other places, whatever you do, do not let your guard down. The virus is still extremely serious and concerning to us all. Any virus capable of shutting down an entire nation is not one to be taken lightly. A few weeks ago, many were asked to stay at home, limit outside and congregating activities. As the weeks have passed, we have learned more about the virus, and based on these findings, we have made some recommendations and some changes. The Health District will continue to share any new interventions or recommendations as they become available. Now, more recently, we have been encouraging going outside and enjoying some outdoor activities. We are also able to move about the community more freely, like going out to eat. While enjoying these activities, you still must stay alert and keep your distance from individuals that are outside of your immediate family. And always, always be vigilant about the level of risk you are taking when planning activities and running errands. Finally, I just wanted to mention, be sure to monitor your mental health. Stress can cause havoc on your health. It can cause an increase in blood pressure, anxiety, headaches, all of which are not good for you and can lower your immunity system. It's important to make time for yourself. Find time to exercise, eat healthier, and get at least 8 hours of sleep each day. There will always be challenges in our lives and in our society, but how we choose to respond to these challenges is what will make the difference and make us a stronger community. Be kind, be smart, and be mindful in the choices that you make. Kind words and smart choices will not only make you feel better, it will also keep you healthier. Let's do this together so that we can be successful in navigating through this COVID-19 pandemic. Please continue to stay informed and visit www.cctexas.com/coronavirus. Thank you.
En resumen, el Distrito de Salud, en colaboración con el Departamento de Bomberos y Christus Pond, han completado las pruebas en los hogares de ancianos. Solo uno de estos realiza las pruebas de manera independiente. 11 personas resultaron asintomáticas y más de 23,000 personas fueron examinadas. Hoy se realizó la toma de 32 especímenes. El próximo día será el 9 de junio en el Centro Hilltop en Calallen. Para pedir una cita, llame al 361-826-7200 si cuenta con síntomas. Otras opciones disponibles son la farmacia CVS en el 3205 de South Alameda o llamando al 814-8305, la Clínica Amistad llamando al 884-2242 o los equipos de pruebas militares llamando al 512-883-2400. En los próximos días esperamos contar con el sistema de pruebas Panther. Este sistema aumenta nuestra capacidad para analizar más de 500 pruebas por día y los resultados se obtienen en aproximadamente 4 horas. Nuestro laboratorio va a ser el primero en el estado en utilizar este equipo. A medida que la economía continúa reabriéndose, le pedimos que continúe practicando intervenciones no farmacéuticas, como lavarse las manos, distanciarse socialmente, desinfectar áreas comúnmente tocadas y no infectarse al tocarse los ojos, la nariz o la boca con las manos sucias. Asegúrese de controlar su salud mental. El estrés también puede causar estragos en su salud. Puede causar un aumento de la presión arterial, ansiedad y dolores de cabeza. Encuentre maneras de hacer ejercicio, comer más saludablemente y dormir al menos 8 horas. Continúa manteniéndose informado y visite www.cctexas.com/coronavirus.
Thank you so much. Barbara Canales, Nueces County Judge. Well, it seems like we're always giving advice these days, and I'm afraid that I need to dispense some about tropical storms. I hope that you all have been monitoring, much like we have, a new named storm called Cristobal. Hurricane season officially started June 1st, and, well, I guess it wanted to kick it off with a bang because here we are June 3rd, and we already have this first named tropical storm in the Gulf of Mexico. It is expected to make landfall near Sunday, somewhere between Galveston and New Orleans. But remember, storms can be hundreds of miles in diameter, and where the center of the storm is not the extent of the danger. And storms, as we know, can change directions, and they can increase or decrease in intensity. So, what I'm trying to say is that it's not just only a tropical storm, and I don't want to take comfort that it's going to come on Sunday exactly where we think it's happening today. And I want you to know that your county, and I know your city, is equipped and ready and prepared to make take all necessary precautions and to be ready to assist with any situation that comes our way. You might say that we are completely battle-tested here in the coastal bend, and although it gives me no comfort to have to tell you to get ready, I feel like it's important that we all realize that we are in hurricane season, we have this named storm, and I want you to make sure that you have your family plan now. There's no more time to wait. We've been sort of talking hurricane preparedness now for over a few months, and I've been pivoting recently in interviews to try to let everybody know that while we have COVID-19 active in our community, all we had to do was to make sure we had an operation plan that could handle both, that would balance the needs of our community with the virus, balanced with what we would do in case of an eventual evacuation. So I just think it's really important that we all recognize that it's time to make that family plan now. And those of you who have lived here, you know what that means. It means get your hurricane plans in place, how you're going to secure your home, what you need to have on hand in terms of food, water, batteries, and supplies. Sometimes when we get into these storms, we talk about fuel, and I will go over all of those details if the time ever arises. But this is a really good time to understand that this is going to be an active storm season according to NOAA, and we are ready and prepared to help you make any decisions that you need that's in the best interest of health and safety. So, here's a really good tip. I would like for you all to get on your reverse alert system on your phone, and this will give you incredible information. Regardless of if this storm doesn't even touch Texas, it's going to affect our waters. It's going to affect the rip currents. And I want all of us to understand that that's what happens when we have a system that comes into the Gulf of Mexico. So here it is, nuecesco.com/reverse alert. Sign up today. It is a fantastic way to keep you and your family safe. And as I said, no matter what happens with this storm, even if it goes to Louisiana, and let's all pray that it dissipates and doesn't do any harm to our neighbors, it's really important that you understand it's going to have some effect in our water. And that's why I think this is a really important tool. So please sign up. This program allows you to opt in, by the way, to receive notifications many ways, phone calls, text messages, and emails, all based on your location. So you get to customize it. And if you don't want to have a reverse alert for everything that reverse alert notifies for, that's okay. But by goodness, you really want to make sure that you have that storm reverse alert with you. And I would suggest that you do rip currents as well. So choose your customization so you can get the notifications, and remind everybody that this is the best way citizens can be warned about imminent threats to health and safety, as well as receive informational notifications. I think that this is a very useful tool, whether you are looking to keep yourself safe at home, work, or in a school environment. Most importantly, remember, it's not just about severe weather. It's about flooding, gas leaks, activity like active shooters and such. Again, super easy to sign up, and the information could save your life. So please do this today. Now, I'd like to pivot to a really important, another piece of advice. I've come to give 3 today. Hurricane awareness and preparedness was my first, and now I want to give you some great advice about how you can help your small business by attending a webinar that the governor of the state of Texas, Greg Abbott, has put together. And as we work on our economic recovery, I want to keep sharing with you valid and vital information that I think will be helpful to our small business owners. You're not a small business owner? I bet you know one. I bet you know somebody that can really benefit by listening to this webinar. And it's free, and it's 1 hour, and it's designed to help Texas small businesses in a way that is efficient, and it'll be done online. Now, the webinar is tomorrow. Tomorrow you have to pre-register. And so it is Thursday, June 3rd. Wait a second, I've got that wrong. Let me double check here. Sorry, June 4th. Today's June 3rd. June 4th, it's from 10:30 to 11:30, but you can go online today and pre-register. And again, let me tell you some of the things that it's going to highlight. You're going to learn how to optimize platforms like Facebook and eBay to enhance your online presence and communications. It'll help you build e-commerce platforms into your business model if you're not already doing it. You can focus on increasing your resiliency, and Workforce Solutions will be on hand, experts will be, to advise attendees on resources that are available to help you be more resilient. And why is that important? I just told you, because we live in the coastal bend. The coastal bend has storms. So the coronavirus is just one kind of a storm. There's the actual wind and water storms. And so let's get ready to be resilient. Also, through SBDCs, those are called our Small Business Development Centers, they are going to guide you on how to get help to expand the needs of small businesses, and they're going to be sharing all kinds of information about these SBDCs, and we have them right here in our own community. And then this is the part I like the best. There's going to be Q&A, and any good webinar has a Q&A section. So Governor's going to kick it off, Governor Abbott, and they have a great lineup, again, from major executives, okay, from eBay, Facebook, Workforce Solutions, and SBDCs. And also the commissioner representing employers at the Texas Workforce Commission, Mr. Aaron Demerson, will also be on this webinar. And again, I believe that it's absolutely essential that we help ourselves. So I'm going to keep giving you and feeding information where I think it's valuable. I think this 1 hour webinar will do you good. So please get online, pre-register. I believe that I was told that up to 10,000 businesses can be on this webinar. So if you find out that you did not make it because the 10,000 filled up, call my office and we'll make sure that we try to get this opportunity to have access to the webinar after the live version goes online. Again, the website to sign up is gov.texas.gov/business/ and also I don't know what I'm saying, -events. I'm thinking splash, I'm thinking summer. Okay, so it's on the television screen as well. So anyway, we're really motivated in Nueces County to help small business. We're going to be working towards more opportunities. We know that the federal government has given some opportunities, the state of Texas has, and we know it's still not enough. So we're going to keep on pressing, delivering ways to you at home to share with your family, friends, and neighbors that help is still coming. And I think this is a great way to begin. Now, when I walked in this afternoon, I was handed hot off the press Governor Abbott's Phase 3 reopening orders, and I think there's some important information here to highlight. So please bear with me as I read to you what Governor Greg Abbott announced today. By the way, it's so hot off the presses that I will not be able to adjust my orders till tomorrow morning, but I'm giving you an audible right now that everything that the governor has, we will mimic here in Nueces County. And although we have the right to be more restrictive, we're going to mimic these orders. So even though our orders currently in Nueces County don't align, I'm giving you my word right now that we will align them in the morning and that you should have confidence that these are the orders of the state of Texas and that they are to be adhered to here in Nueces County effective immediately. So unlike other orders that wait to come into play, these orders are effective right now. So here we go. In this third phase of the state of Texas's plan to open the economy, all businesses in Texas will be able to operate up to 50% capacity with very limited exceptions. Businesses that previously have been able to operate at 100% capacity can continue to do so. And most outdoor areas are not subject to any capacity limits. All businesses and customers should continue to follow the minimum standard health protocols, and you know those are the ones that Annette lines out for you every time she gets up here. And so, as with previous phases, this Phase 3 plan is based upon the advice and support of the 4 doctors on the strike force to open Texas via executive order, and as I said, this begins immediately. The people of Texas continue to prove that we can safely and responsibly open our state for business while containing COVID-19 and keeping our state safe is what the governor has said as of this afternoon. So I believe that there are some highlights here, and here they are. All businesses currently operating at 25% will go to 50%. Bars and similar establishments can increase to 50%, and here's something that's important. So long as patrons are seated. So long as patrons are seated for the bars. Amusement parks, carnivals in the counties with less than 1,000 positive cases can open at 50% capacity. I'm unaware whether we have any carnivals in town right now, and I know that Waves is not open this summer, so I don't know how that directly affects us, but there you go. Restaurants may expand their maximum table size from 6 to 10 persons. 6 to 10 persons. Mayor Joe and I, our families can now sit together because that is, we don't make it under the 6 rule. So the restaurants can expand their occupancy levels to 75% as of June 12. And on June 19th, there's going to be some more additions to amusement parks and carnivals. And there's some interesting information about counties with 10 or less active cases, but we don't fall in that group. I'm going to make sure that this is probably already on Corpus Christi's website because they're so fast, and it'll be on Nueces's as well as we're linked up. Special provisions have been made for outdoor gatherings such as 4th of July celebrations. Here's an important but it is imperative that local officials, that would be myself, Mayor McComb, and public health officials, that would be Dr. Ram and Annette Rodriguez, collaborate on safe standards. So let's cross that bridge in a few weeks, but I think it's really important that the governor looks to the locals to make sure that we can collaborate, to make sure that all our celebrations have safe standards. These provisions are included in the governor's executive order, and they're online at Open Texas webpage. And again, I'm going to make sure that I get a complete listing of some of the local ceremonies that are planned for July 4th, and we'll make certain that we all work together to make, to do everything we can to continue in the efforts that you've heard today. You're only hearing from electeds now once a week, but please don't let that be a deterrent from letting us know how we can help you. Although the hotlines have diminished and the calls do not come in as frequently, I'm still there. I'm not going anywhere. So if you have a concern, a question, something that's really important to you, we want to hear it in Nueces County. So please do that. Let me just end by saying that I'd like to echo what City Manager Zanoni and Director Rodriguez said about COVID-19. It is so easy to get distracted with the fact that our numbers have been unusually low. In fact, the lowest of the top 15 counties in Texas. And also, as we continue to reopen Texas, going through our many phases, phase 1, phase 2, and now phase 3, I've started to see the, I would say, the relaxation of normal, everyday citizens. And I want you to know that I understand it. I saw someone who just motioned to shake my hand just because it seemed so natural and so comfortable. Another lovely lady who wanted to give me a hug about a particular celebratory moment that she had. We forget, because our numbers are so good, that this virus is still so active. So I would ask you, as we recover, as we come into our phases, don't lose the incredible work that we have accomplished together. Let's make sure that we continue to stay smart and really stay very diligent about keeping each other safe. As we talk about storms and hurricane preparedness, I'm more mindful than ever the duties that all of us have. I just told somebody that my favorite line of our opening web page in our courthouse says, we can all be leaders in this effort. And I truly believe that. And I know that our country and our communities are experiencing tremendous emotion, grief, some sadness. And I can tell you that these are difficult times. But I know that we have gone through these 3 months together for a good reason. And we are going to emerge, I truly believe, stronger than ever. But it is no time to forget everything that we have learned. Let's make sure that muscle memory stays in place. And again, please reach out if we can be of help to you or to your business. Thank you so much.
En resumen, espero que esté monitoreando la tormenta Cristóbal. Se espera que toque tierra el día domingo entre Texas y Luisiana, pero bien sabemos que las tormentas pueden cambiar su trayectoria. Le quiero recordar que su ciudad y condado estamos preparados para cualquier eventualidad. Le recuerdo que estamos ya en época de huracanes y le pido que tome todas sus precauciones, especialmente para tener segura a su familia. Si no tiene un plan preparado, hoy es el momento para hacer esos planes. Le quiero sugerir que se inscriba a Reverse Alert para que reciba información. Lo que debe hacer es ir a la dirección nuecesco.com/Reverse Alert. Con este programa usted recibirá información por texto o por teléfono y estar así informado por emergencias. Junto con información climatológica también va a recibir otro tipo de emergencias. El gobernador va a presentar un seminario por internet gratuito para los pequeños negocios. Este estará disponible para inscripción el día de mañana. El seminario va a ser el día jueves 4 de junio de 10:30 a 11:30 de la mañana. La dirección es gov.texas.gov/business/events. En este seminario se va a dar información importante para los dueños de negocios y otras agencias. Asimismo, la fase 3 de reapertura del Estado va a dar comienzo. Mi oficina va a reflejar esas órdenes el día de mañana por la mañana, pero entran en vigor de manera inmediata. Los negocios podrán trabajar al 50% de su capacidad, pero siguiendo los protocolos de salubridad. Si los negocios estaban abriendo del 25%, podrán ahora abrir al 50%. Los bares podrán tener el 50% de su capacidad siempre y cuando los clientes estén sentados. Los parques recreacionales podrán abrir al 50% de su capacidad, así como las ferias. Los restaurantes ahora podrán aceptar una capacidad de hasta 10 personas en una sola mesa. El 12 de junio los restaurantes podrán tener la capacidad del 75% y el día 19 habrá adiciones para parques y ferias. Para el 4 de julio podrán haber celebraciones, pero adheridas a las reglas locales. Esas reglas se van a dar a conocer en los próximos días.
Okay, thank you. Joe McComb, Mayor, and it's been a while since we've been here, so we're glad to be back. And we got, I think, some good news on our numbers. And just want to reiterate that what Mr. Zanoni said, that as we speak today, the ratio of the number of tests given to the number of tests positive, we're at a 2.534%, and that is a great number. While we hear a lot of other numbers tossed about, we hear a lot of averages tossed about, to me, that's an extremely significant number in our community, and I think the reason it's significant is I think it's a reflection on the support that the community has given in trying to make sure that they keep themselves safe and their families safe. So a 2.5% ratio of tests to positive results means that from our population standpoint, that's a very small number, and we're very appreciative of that, and we, again, encourage you to continue to maintain what you're doing. While we're doing that, we've also had people continue to provide information and funding for the assistance to our nonprofits in the community to help people, businesses, and individuals, both in their rent payments or utility payments, trying to keep their businesses up and running. We've collected on the mayor's disaster relief fund. We've collected $270-something thousand, distributed over $270,000. I got a notice today, we've got another $25,000 contribution today, and as soon as that money's in the bank, we'll get it out, so that'll put us over $300,000. And for those of you that wonder, there's no tax money in that. That's all the generosity of the community coming together to help their neighbors. And so there's no tax money in that. That goes to the Coastal Bend Community Foundation, and they help assess the needs, who needs it the most, and who's getting the biggest bang for their buck, and we try to help them out get a little bigger bang. So we appreciate that support that we've received, and we'll continue to do that even though our numbers are good. We've still got a ways to go till we're out of this, what I call the COVID mess, but we're going to survive it, and we're doing well. I think an indication of that, there's a lot of excitement about the opportunities to open, and I think probably there's even more excitement now that the governor's opened it up to 50% as opposed to 25%. And so the Chamber of Commerce has started a project called 30 Days of Small Business. We're open. And what we're trying to do is to let people know that a lot of businesses are open, even though they're at reduced capacities and the ability to generate as much revenue as they can. These business owners and their employees want you to come to their business. They're taking all the precautions that are needed to keep you safe while you're there, but they've got bills to pay. It's interesting, your rent doesn't go down. The utilities, you still got air conditioning, you got lights, you got water, utilities. Those expenses don't go down substantially, whether you've got 25 or 50% capacity or even 60%, depending on what business you're in. So those are pretty consistent, and they come around every 30 days. And so they are really wanting people to come and shop locally. And let me just encourage you to do that. Stay off the internet. You don't need to be buying online. Buy local, spend your money local, and help our local economy get back on its feet. Now, that would be a significant contribution that you could make on behalf of yourself as well as our local businesses, and we really do appreciate that. So we're starting now, and you'll be seeing we've been to several of these announcements at local businesses that are open and up and running. And I went by and had lunch at a restaurant today. There was tables spread out. You know, there are tables there. You could put 4 to a table. Well, they had some that had 6, but at ours we just had 3. But it was, I can tell you they're glad to see you coming in. So let me encourage you to begin to move back out in the community if you feel comfortable. If you don't, I understand. But life is going to continue, and life is going to get better. And so we want to let you know that we're continuing to stay on top of this and make sure that our community is safe. One of the things we're beginning to plan now is and the judge alluded to that, is what celebrations are there going to be for the 4th of July? Well, I don't know what all of the celebrations are going to be because we really don't know what the rules and regulations are going to be, but I can assure you on behalf of the City of Corpus Christi, we will have a fireworks on the 4th of July. HEB has been a wonderful sponsor over the years, and they're back on board again this year to help us celebrate the greatness of our country and have a celebration with a fireworks display. There may not be the final plans have not been made. There may not be a big whoop-de-doo down at the park on Shoreline at the water's edge, but there may be some opportunity at least to go and, walk down there, go to a parking lot and position yourself to where you can see the bayfront and at least see some fireworks with your family, because there may be we're going through some rough times right now, but we cannot ever forget and should never forget to celebrate what a great country that we do live in, and that's coming up on July the 4th. So again, I want to thank the citizens of Corpus Christi, Nueces County for maintaining the vigilance and protecting yourself and your family. These numbers are good. Ours is 2.5. The state of Texas is 5 point something in terms of their positives to tests given. So we're doing great, but that we can't give up. So stay the course. Go out and buy locally. Again, stay off the internet buying stuff. Go spend your money locally because that's a significant part of our economic recovery. And I was delighted to hear the governor today open it up to 50% for those opportunities that businesses have been restricted down to 25. So we'll look forward to seeing you next week, and on a daily basis, city manager will continue to put out the daily information for the numbers. They're going to fluctuate from day to day. So when you start hearing up here, down there, up there, average, I remember one time in school, one of the teachers told us, you know what the definition of average is? And the class wasn't real sure, and they said, well, definition of average is it's the worst of the best and the best of the worst. So look for the real numbers. Averages are good, but look for the numbers. And I think right now the numbers on our positives to the relationship to the number of tests is excellent. We're going to continue that testing. We want to try to identify those that have it or the carriers and advise them so they can take the proper steps not to expose others to it and do what they need to do to protect themselves. But I think we're doing well, and that goes to you. We can't make you do these things, but we certainly do appreciate your participation and your support and your actions. So we'll see you next week and see where we are. Thank you.
En resumen, hay buenas noticias en cuanto a las cifras por el virus. 2.5% de las personas examinadas han resultado positivas a la aportación del virus, lo que es buena noticia en comparación a otras ciudades. Le quiero recordar de nuestro fondo de ayuda. Hemos recibido más de $270,000 mismos que han sido entregados como donaciones. Estos fondos son solamente donativos y no son impuestos. La Cámara de Comercio va a tener un programa para apoyar a los pequeños negocios. Con este apoyo se ayudará a que los negocios paguen por sus deudas. Compre a nivel local y no por internet. Así podrá ayudar a su comunidad. También estamos planeando la celebración del 4 de julio. Aún no contamos con todos los planes, pero sí tendremos juegos pirotécnicos, gracias al patrocinio de las tiendas H-E-B. Asimismo, le quiero agradecer a la comunidad por su participación y evitar así la propagación del virus.
Okay, I'm going to just do one more thing, and then that will conclude our briefing, and we'll see if there's any questions from the media. So this is on some testing that's taking place. I know Annette mentioned our drive-through testing was today, and there'll be another one next Tuesday, or next Wednesday, right? But there's additional tests. There's 5 new test dates and locations that I want to tell you about. And those include the Texas National Guard will be doing testing tomorrow. And Tuesday, June 9th, right, what's today, just double check here, yeah, Tuesday, June 9th, at Hilltop Community Center at 11425 Leopard Street. Okay, so tomorrow and then next week, Tuesday, there'll be testing by the National Guard at Hilltop Community Center on 11425 Leopard Street. And it will begin at 9 a.m. and there we go. There's a chart up here. It'll begin at 9 a.m. and it'll conclude at 5 p.m. We'll also have testing Friday, Saturday, and Sunday, this coming Friday, Saturday, and Sunday, June 5th, 6th, and 7th, and that's going to be at the Richard Borchard Fairgrounds in Robstown. Okay, so that's a good opportunity, 3 days in a row from 9 to 5 as well. And it's the state mobile testing. The state will be conducting those tests for persons. That's at 1213 Terry Shampsey Boulevard. Okay, so those are 3 additional test opportunities on top of the 2 I just mentioned. And again, tomorrow and Tuesday at Hilltop, well, okay, we already mentioned that, so tomorrow, next Tuesday, and that's it. For both of these tests that I talked to you about, an appointment is required, and you can register online at, I think it's on the chart here, texascovidtest.org. TX, I should say, not Texas, txcovidtest.org, or you can call 512-883-2400. So for those 5 testing opportunities, which includes the National Guard and then let's see, what was the other one? The other testing site, a testing entity, you want to go online and register or call that number to be able to get one of those tests. Okay, so that concludes our information. We want to thank the community for watching. Thank you for the local stations that are covering this live, and thank you for the Call of Times for covering it as well. We appreciate those that have been watching through Facebook and YouTube and through TV. So at this point, we'll see if there's any questions from the media for either myself or the county judge or mayor or our public health director. Okay, you guys are going to let us off the hook today then? All right. Okay, very good. Well, that concludes our briefing. Just one quick reminder before you sign off, which is this Friday at 3 o'clock. We'll have our team here from Texas A&M Corpus Christi, Dr. Bird, who the community loves and has really grown to set their appointments up to make sure they get a chance to watch him. He'll be 3 o'clock this Friday. So we'll see you then. And just as a reminder, the city-county webpage is still being updated every day. There's a mobile website, too, that has a good dashboard, and then there's more information online. So if you want to get up to date on number of cases, number of recoveries, where they are by zip code, just visit us on our web pages. There's a pretty easy-to-see button that'll take you to those dashboards of information. All right, thank you. Stay safe.